This is Dr. Benzinger on Health with secondopinion.org. At secondopinion.org, if you have not registered for our free newsletter, please do so. That'll keep you up to date on any other information that's coming up, and we come out with things every single week from experts in their field across the world that will help you encourage a better way of treating yourself and hopefully empowering you to treat yourself in prevention as well as if you are in a present disease condition. Heart disease is what we're covering in today's brief vignette. It's a big subject matter, but it still comes down to the same thing. Will you choose to control your disease and your future, or will you allow the disease to control you? Most of us don't like people telling us what to do or how to do it and when to do it, but diseases, once they take over your life, control you and make you do things because, frankly, it could threaten your life. What we know is cardiovascular disease is the #1 killer of the United States of America, and 68 million of people are affected by it, and 200,000, the first symptom is death. If you're playing the statistics, waiting for a health condition to come, it's the #1 reason that Americans die, and #2, 50% of the time if you get a heart attack, you die. You don't get a second chance. That 50% that do, that's a great thing, but why would you play a 50-50 with your life? Why not prevent it from occurring in the first place, doing all that you can to do so, and so you empower yourself to eliminate this chance of you just dying? It's not worth it, is it? Heart disease costs us already $403 billion in direct and indirect costs, and 70 million people are having some form of cardiovascular disease right now. Women 34%, men in the 50% range. And what we know right now is that the fact or fiction is this. Heart disease is caused by, they say, high-fat foods. Well, maybe it's not high-fat foods, it's high trans-fatty foods. The second thing we're told is high cholesterol is the cause of this. Well, you're going to see later that that maybe doesn't make a whole lot of sense. Poor diet plays a role, but we know the cholesterol campaign is not necessarily based upon all the scientific proof that it's reported to be. Is it a contributor? Yes. Is it the sole cause? The answer is absolutely not. And all the scientists don't support the idea that cholesterol is the sole cause of the reason that you get heart disease. So let's talk about cholesterol. It's a fat. It's a precursor to every hormone in your body. If it's too low, hormones won't function in your body and you will have other conditions. It helps your skin stay young and flexible, and some of the well-known authorities that are dermatologists in the country will tell you that if they're on statins and their cholesterol gets too low, they start having skin conditions. That's not uncommon. 90% of all cholesterol is produced in your liver and 10% by your diet. So cholesterol is not bad. It's just certain types that might not be good if there's too much of it. So keep that in mind. The body's already producing it. Is it bad? The body's already producing it. Probably not. It probably plays a key role. In fact, cholesterol is in every single cell in your body. So the biggest issue of today is what's fact, what's fiction. Let's try to at least put a few things to rest at this point. Okay? 50% of the people who have heart attacks have normal cholesterol according to the standard lipid panel that is done in the country. So if 50% do and then 50% don't, maybe cholesterol is, again, part, but not the whole picture. When you look at how we withdraw cholesterol from the bloodstream, it's through one of these little sticks in the arm, usually, or the back of the hand or the back of the foot, and then you can see kind of a picture of what cholesterol looks like in the bloodstream. There's different components of cholesterol, and all of us probably know that HDL, high-density lipoproteins, are considered to be good cholesterol. Forgive me. They are actually a protein cholesterol product, but HDL actually comes from the cells and carries LDLs back to the liver to clean them up. So the more HDLs you have, the more it goes out and gets LDLs, the low-density lipoproteins, and takes them back to the liver to clean them out. So the more HDLs you have, the more protection you have of not ending up with too much cholesterol in your system that could harm your arteries or other parts of your body. Bottom line, more HDLs is good, less LDLs is good. Okay? Cholesterol is an important element. 90% of all cholesterol is stored in your cell membranes. So if you didn't have cholesterol, you wouldn't have cell membrane. You wouldn't have hormones. It's a big issue. Liver digestion and bile production is based upon the liver. And steroids are #1 ingredient. In the bloodstream, the precursor for vitamin D and lipoproteins is cholesterol. We know vitamin D plays a very big role in lots of areas of the body: osteoporosis, skin, cancer, and heart disease. Okay? Without cholesterol, we would be in trouble. Okay? The limitations of predicting coronary heart disease: a 26-year follow-up study to the famous Framingham Heart Report showed the following. 50% of people who developed heart disease are missed in the routine lipid panel. 75% of the patients with myocardial infarct have normal levels of LDL and HDL cholesterol. 75%. And 80% of those patients who had an event in the landmark Framingham report had lipid levels identical to the population that was event-free. Okay, so if 80% that had problems during the study compared to what was normal outside of the study that didn't have, or was inside the study that didn't have a heart problem, why would that be the case if this is the problem, the sole problem? Here's just kind of a picture of what LDLs and VLDLs. You see the HDLs are actually much smaller than these VLDLs and LDLs that are so bad, quote unquote, for you. What you've been told? It's been established beyond a reasonable doubt that lowering blood cholesterol will reduce the risk of heart attacks caused by coronary heart disease. 1984. If your cholesterol does not decrease, you may die soon. You ever been scared to death? Oh my gosh, you don't start reducing it today, you're probably going to die in a week. It's the feeling you get. Here's what's interesting. There's more calcium in the plaque that causes heart disease or coronary heart damage than there is cholesterol. Does that mean we shouldn't have calcium anymore either? Probably not. Okay? There's no research documenting, because if you notice the cholesterol levels have lowered again and again, but there's no documentation as to the lower levels they've come up with. Just like the theory of ridding Americans of all fats will reduce heart disease, remember what that gave us? Obesity and diabetes. So keep in mind that sometimes when we jump for an answer because the public's demanding it, sometimes medicine has actually not found the true cause, and unfortunately, instead of saying we just don't know for sure, we just know good diet, exercise, keep saturated fats down and do this and this is a good thing. No, we want to say cholesterol is the sole cause. Okay? In the same NIH meeting, in that meeting, other causes were found. In fact, Professor Michael Oliver, who's the director of the World Health Organization trial, other causes were identical to the cholesterol theory. Why explain them away? Something ridiculous has happened. Richard Petto, who is an epidemiologist, and there was no evidence in the statistics. Why lie? Paul Meyer, biostatistician, came up with. Dr. Mary Innig, she is an international expert in lipid biochemistry. She said the following: the idea that saturated fats cause heart disease is completely wrong. But the statement has been published so many times that it is difficult to tell people otherwise without them being willing to read extensively to prove differently. Michael Gurr, Associate Professor of Biochemistry at Oxford. The arguments and discussions of the scientific evidence presented in this review will not convict those experts who have already made up their mind for whatever reason, money or otherwise. So in the media in the last 7 years, there's 15 citations that say there's no difference in heart attacks in regards to cholesterol levels. But there's over 600 citations in support of cholesterol being the #1 cause of heart disease. You hear, you see, you read it enough, guess what? It's got to be true, even if it might not be true. So what is true? A prudent diet can lower your cholesterol and can lower your risk of heart disease. A specific diet may be from Cholesterol Down. If you'll look at the book, Cholesterol Down, at secondopinion.org, review that interview. You will be amazed at the possibility of controlling certain types of foods and dietary changes that mimic statins. The medication called statins mimics their lowering of cholesterol, but with none of the major side effects that statins bring. So what we do know is this, again, what's common treatment? Drugs effectively do lower cholesterol, but many cholesterol-lowering drugs are dangerous and may shorten your life through other conditions. Drugs such as statins do lower heart attack deaths. They may have nothing to do with lowering cholesterol because they also are anti-inflammatory, they're finding too, but it also might increase your cancer risk. Here's the side effects of a statin medication if you're on one right now. Headaches, GI complaints, nausea, diarrhea, constipation, fatigue, flu-like symptoms, myalgia, soreness, weakness, pain, myopathy, inflammation, and soreness. Does it mean you stop this medication without your doctor's advice? Absolutely not, but you do talk to them about these side effects. Okay, here's the good news. People with low cholesterol develop just as many plaques as those with high cholesterol. I guess that's not really good news, is it? In fact, older women with mildly higher cholesterol live longer than women with low, and cholesterol levels may be a limited factor in women because the majority of the research was done on men, not on women. You've heard this before. It's kind of scary, isn't it? So the whole idea that lowering cholesterol might not change the amount of plaques that you get makes you wonder, what do we do? Well, you do the basics, okay? We'd rather see the media start talking about the real facts, not told to the public, so you can start making the choice. Cholesterol correction campaigns create immense prosperity for researchers, some doctors, drug producers, and food industry. But does it help you heal the condition? Maybe we should start something new called the oxidation story. The whole idea that poor diets, general food habits, lack of good water, nutrients, lack of exercise, too much alcohol, drugs, and a poor mental attitude might predispose you to those stressors that predispose you not only to cancer, arthritis, diabetes, obesity, autoimmune disease, but how about heart disease caused by the oxidative theory? Okay, oxidative means it's actually damaging your cell membranes by the habits in which you have by oxidized fats, cholesterol, that actually is hurting your health. So since we know cholesterol is at least part of the story, there are 10 ways to improve it on your own. And this is from Cholesterol Down. Eat oatmeal, almonds, flax seeds, psyllium husks, beans, apples, special margarines with phytosterols, soy protein, garlic, and exercise. There's one meal that was called a poly meal. It's called the British Journal of Medicine study, and they found that 5 ounces of red wine, 20 to 30 pieces of almonds, fruits and vegetables, a little bit of garlic, fish, and dark chocolate seem to lower cholesterol. Now, can you eat that every day? Probably not. We're not going to recommend that you do so. Okay, here's another one. Life-changing. Dietary Approach to Stopping and Reversing Heart Disease, the book by Caldwell Esselstyn, MD, well-known authority in this area. Review his audio interview on our site, secondopinion.org, and it will floor you. What's he say? Eat 7 to 8 servings of whole grains, 4 to 5 servings of vegetables, 4 to 5 servings of fruits, 2 to 3 servings of low-fat or non-fat, non-dairy products, no meats, no poultry, no fish, no fats, no nuts, beans, legumes, almonds, and walnuts, no salt, but maybe add Bragg's amino acids because it tastes salty and makes it taste good. And he's saying he's completed a 20-year study that shows that not only can you help heart disease, but you can reverse the condition. Now, isn't that something new? A well-known authority steps out of the box and says, well, you know, once we get them on, you know, high blood pressure medications and they have bypass surgery or they're on this medication, they don't seem to ever get better. In fact, they just slowly, progressively get worse. We try to keep them together longer and then we keep medicating them more and more. And he said, I just couldn't stand that anymore. So he said, I started this study with people that were supposed to die. They were supposed to live more than 2, 3, 4, or 5 years. So we did the study, changed their diet, they honored it. Guess what? 20 years later, they're all alive. None of them are supposed to be. Why? And not only does that happen, but more importantly, their heart is healed or healing in a way that we never thought was possible. And just eating a good diet, keeping stress down, and living a better quality life made all the difference in the world. Isn't that something? All of you, 70 million of you can hear this video and say, oh my, let me get Esselstyn's book. Let me change it. Let me control my own future. Let me empower myself. Work with my doctor, but push to get your life back. Wouldn't that be exciting? 30 minutes of exercise, 19% reduction in LDLs. Don't smoke. It decreases diabetes, helps you live longer, reduces cancer risk, and improves your brain function. And all of us need a little help there, don't we? Exercise can include the walking, running, sports, swimming, bowling, weightlifting, yoga, meditation, hypnosis, and biofeedback. Nutrient support that we know helps in these areas maintain better quality life is multiple vitamin and mineral, magnesium, key for heart, EPA, DHA, which are fish oils, garlic, coenzyme Q10, mostly important if you're on a statin drug. L-carnitine can help. And if you're not on medications, okay, or you have to have the approval of your doctor to go on hawthorn or ginkgo biloba, pycnogenols, niacin or niacinamide, okay? Fish oils help make a big difference. I mentioned this earlier. Dr. Santini, chief cardiologist in Italy, says, you know, it's part of the international guidelines. This is considered tantamount to malpractice in Italy if we omit fish oils. We'd never do that. So what do? You don't smoke. You maintain your ideal body weight. You balance your blood sugar. You lower your blood pressure. You reduce your stress. You follow the dietary recommendations of maybe a DASH diet, cholesterol down, or Dr. Esselstyn's Prevent and Reverse Heart Disease diet. You follow a Logic nutritional support program, exercise, reduce or eliminate alcohol and drugs, and develop a positive mental and spiritual attitude. And you will have done some wonderful things to make a choice to control your own future and not let the disease control your future. That's the focus of today on heart disease. Hopefully you've enjoyed it. We'll look for you next time. This is Dr. Benzinger on Health with secondopinion.org. Join us. And may God bless you.